Hello, hope you're doing well. Akakuba Mkalaliye. So, today is a Monday and I thought of us discussing about central line associated bloodstream infections. Which people need a central line? How does this central line infection come about? Why do they need a central line? How can we prevent that central line infection? What are its signs? So if you really want to know, stay connected on our TikTok channel and also our YouTube channel. So first of all, a central line is that long tube that is normally inserted in a big vein that connects to the superior or inferior vena cava. So which people need this central line? Bani abakozesa central line. I know many of you are told in hospital that iyo omulwadde waffe yeetaaga central line, and you're like, central line kigenda muyamba ki? So here are the people that need central line and why they need it. Number one, critical care patients or ICU patients. Most of these people in ICU need a central line because number one reason is, or indication for that central line, remember they do continuous tests on these people, meaning they'll have to take off blood all the time. So imagine that irritation of being pricked all the time to take off blood. So a central line makes it simple. Number two, most of these ICU patients need blood transfusion often. So kibanguyira baconnectingako wali buconnectinze. And also these people might take long, their recovery might take a long time. So nayo indication ya central line. Other people that need a central line, cancer patients. Cancer patients have a central line or a chemo port. Down here will be some of the examples and different types of central lines. So bikuyamba n'osomako notabeera ignorant ng'otudde omulwadde wo mu ddwaliro oba nga muli waka nga tomanyi na central line kiki, lwaki agiyina. Okitegeera, we need to be elite sometimes. So cancer patients use it for chemotherapy. Jjukira eddagala eryo ly'amaanyi ate lyokya kagundi kakanyula kayinza obutatukolera. Also nutrition gundi. Malnourished patients tend to get a central line since n'obusuwa buba tebalina. Patients that don't have, their veins are not visible or they are collapsed. That is common in the malnourished patients. So we put a central line nebabasa ku gundi, ku nutrition waliwo amagunde, that protein they give them. So also patients going for hemodialysis, oba abo bwe bagamba nti agenda ne bamukyusa omusaayi, they also need a central line. Nabo bakozesa central line. Then also people that are going to take long on IV medication. There are those people, especially those ones in coma, long-term illnesses that really need IV medication. Nabo tubasigaza ku central line. A central line is something that is good because it simplifies our work as medical personnel most times. But if neglected or not well taken care of, it can become into something that is hazardous to our bodies. So here are the causes of central line associated bloodstream infections. Number one is poor insertion techniques. Remember, most of the times this central line is inserted in either the ICU or theater. So if they use poor insertion techniques, you are at a risk, you're exposed to those infections. These infections occur when a bacteria goes through the bloodstream of the entire body. Jukira kugenza direct mu mubiri, meaning managing it will be a bit tricky. So another cause is prolonged use. These central lines are not supposed to be in for a long time. So at some point they need to be changed or even removed and change sides. Nego osigala naye for long. It's just like this peg tube for food. You shouldn't stay with it for long. Manya 8 months you're with one central line without it being changed. Oh God. Infections are at risk of coming now. Those are basically the causes or risk factors. There are 3: poor techniques of insertion, prolonged use, and also failure to change of dressing, failure to change dressings or using unsterile equipment while dressing that wound. Nayo cause. So dear nurses, take caution. Ways of preventing that infection. Number 1 is proper insertion of the tube. Then use of proper guidelines and techniques while inserting and also dressing. Then also regular maintenance or change of dressing and the tube itself. So that's basically I wanted to share with you about a central line. The prevention of central line associated bloodstream infection is regular maintenance of that tube. If it is that blood is no longer passing well, you remove or change. Also, letting air pass through that central line can also cause some emergency or some illness. So as we are caring for patients with central line, let's take caution. Wabuntu tebulina buleka nga buli open, empewo esobola oyingira oba omusaayi ne gufuluma. Also bacteria, there are some microorganisms that we can't see but they can spread disease. So bisobola oyingirira awo. It is now an opening that enters directly into the bloodstream, and that bloodstream goes directly to the heart. So we need to take caution. I remain Musawo Pauline, CEO LP Wound Care. We look forward to working on your relative, your mom, your grandma, your friend. We offer home care services and bedside nursing. Thank you. Have a lovely day.